this is the apex, and this is the base. So now we're going to go to the, so this is the left side. So this is the left ventricle, and this is the right ventricle. I'll show you the left and right atria in a minute. So this is the left auricle, and this is the right auricle. Next, you want to identify the pulmonary trunk, which is right here. The ascending aorta, the aortic arch, and the descending aorta. Now, the pulmonary trunk bifurcates. So if you look at it, if you flip it to the posterior view, you can see the bifurcation between the left pulmonary arteries and the right pulmonary arteries, which are in blue because they're deoxygenated blood. Below that, you have, so inferiorly, you have the left pulmonary vein and the right pulmonary vein.
Then we have
This is the superior vena cava, which, as you can see, leads into the right atria, and then the inferior vena cava, which is on the posterior side, is the large hole, which also leads into the right atria. All right, the ligamentum arteriosum is the white fibrous structure that connects the pulmonary trunk and the aorta. Okay. The coronary sulcus is so it separates the atria from the ventricles. So it runs all along the side. So, and then you have the anterior interventricular sulcus, and then on the back side you have the posterior interventricular sulcus. And I think I already did.
You already did.
Yeah, I already did
Okay.
the descending.
Now we're internal anatomy.
Okay. Yeah. So now we're going to take off the front. So I think it's easiest to see the anterior atrial septum if you look at it from the sides. So it is technically directly below the pulmonary trunk and aorta, separating the two atria from each other. So the interventricular septum separates this. The layer is called the myocardium. The tricuspid valve, which is better to see on the large model, is in between the right atria and right atria and right ventricle. It's here. And the bicuspid valve is between left atria and left ventricle, which is here, which is, I don't think I said this. So this is the right atria, this is the left atria.
Yeah.
Okay. So I don't know how to pronounce it.
Chordae, tendae
Are the white fibrous structures, and the papillary muscles are the muscle where it directly connects with the chordae tendae. Right there? Yep. Okay. The pulmonary valve is connected to the pulmonary trunk, and it is a semilunar valve. The aortic valve is connected to the aorta. It's also a semilunar valve. The fossa ovalis is the white depression in the right atria, and the trabeculae carneae are the ridges. They're more prominently seen in the right ventricle, is where the Purkinje fibers rest underneath.